Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's episode, we're going to be discussing a medication known as Amiodarone. Its brand name would be Cordarone. And before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. In this video, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe amiodarone to a patient, followed by contraindications or reasons we would not be able to prescribe this medication. Then touch on examples of dosing, and finish it off with side effects with percentages. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So amiodarone hydrochloride is an antiarrhythmic drug. It lengthens cardiac action potential and blocks myocardial potassium channels, leading to slowed conduction and prolonged refractoriness. It also rapidly blocks sodium channels. In terms of indications or reasons we would prescribe this medication to a patient, we would often see this medication used in the treatment or prophylaxis, or prevention, of life-threatening ventricular arrhythmia. There are also some other off-label indications where you may see this medication used. With respect to contraindications or reasons we would not be able to prescribe amiodarone to a patient, we first of all wouldn't give this medication to a patient who had a hypersensitivity to amiodarone or any other component of the formulation. If a patient had cardiogenic shock, they would not use this medication, as well as second or third degree atrioventricular block. Patients with bradycardia leading to syncope or fainting without a pacemaker would not use this medication, as well as patients with severe sinus bradycardia or slow heart rate. Now for examples of dosing with this medication, so in the treatment of ventricular arrhythmia, if you're taking the medication through an oral tablet, the loading dose would typically be 800 to 1600 milligrams orally daily until a therapeutic response occurs. Now you would administer this dose in divided doses. You wouldn't take it all as one single dose. In terms of maintenance dosing, after control is established or side effects become prominent, then you would reduce the dose to 600 to 800 milligrams per day for 1 month, and then usually down to 400 milligrams per day. As with all medications, there are some side effects or adverse reactions that patients may experience while using amiodarone, so I'll go over some of those here now. 1 to 15% of patients may experience hypotension or low blood pressure. 3 to 10% may experience photosensitivity. Thyroid dysfunction may occur, as well as constipation. This may happen 4 to 9% of the time. A loss of appetite may as well happen 4 to 9% of the time. And nausea and vomiting come in between 10 and 33%. Fatigue seems to happen 4 to 9% of the time. Some patients may experience increased liver enzymes or abnormal gait 4 to 9% of the time, and same percentage would be for coordination problems, dizziness, movement disorders, or visual disturbances. Alright everybody, that's all we're going to talk about today with amiodarone or Cordarone. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.